patient. These are the real stories of the ER, told by the real doctors who live them. Okay, no pulse.
Clear.
These are the untold stories of the ER.
My name is Dr. Armand Dorian. Med school didn't prepare me for this. 8 years of emergency medicine didn't train me for this.
Forget the fancy textbooks, the expensive medical equipment. All I have is what's on my back. I'm a thrill seeker, not the kind that jumps out of a plane, but the kind that saves a life.
I'm the medicine man.
He's the medicine man who's turned John Stamos into a medical wonder.
Pulse 84, systolic 86.
Now, ER's medical technical advisor is an extra life changer.
I'm Dr. Armand Dorian, and I'm your emergency physician.
And for the first time on TV, we're setting up your own personal appointment, so go ahead and open up and say, ah.
I've had a sore throat for 3 days. Do you think it could be strep?
Tender lymph nodes along the front of the neck, gunk at the back of the tonsils, fever, lack of cough. Those are criteria for needing antibiotics.
I twisted my ankle. Is there a way to see if it's broken without paying for an x-ray?
Ankle fracture versus sprain, there's a few places you can actually push on the ankle to tell the difference. Ankle, please. If you push here, here, down here, you squeeze down here, you squeeze up here, and if you can walk on it, it's really unlikely to be broken.
I have chronic indigestion every night. Is this reason to go to the ER?
Indigestion can actually be a sign and symptom of a heart attack. Are you having any other symptoms with it? Are you having any jaw pain, any arm pain, any sweating at night?
Sweating. I sweat a lot.
Because 1/3 of heart attacks are caused by symptoms that are not chest pain, I would definitely recommend you go to the emergency department to get checked out.
As for the weirdest medical emergency Dr. Dorian's seen,
I had a patient who had dug pockets underneath her skin, in her arms and in her legs, and she would stuff them with earthworms. Stranger thing is she actually had named these earthworms, and as I pulled them out, she'd say, that's Kenny, that's Elvis. So that's pretty strange.
I'm on a high. I feel like I can answer pretty much any problem. I feel like I'm really doing a great job as an ER physician. I walk up to grab the next chart.
All I know is she's complaining of worms.
Worms. It just says, I've got worms inside of me, and it's put in quotation marks.
Kate, can you do me a favor? Can you grab some stool samples, containers, and bring them with me to the bed?
Sure, let me just go wash up.
Okay, thanks a lot.
I'm thinking of possible parasites that this patient might have. I'm thinking of what area did she perhaps travel to.
Hi, dear Ms. Frida. What's the matter, dear?
The patient is not 100% with regards to her mental status. She is a little off.
What brings you to the ER? How can I help you?
I've got worms in me.
Yeah, I saw that on the note by the nurse. What do you mean you've got worms in you?
I have worms in me?
Have you seen these worms?
I have worms. They're in me.
She just keeps saying, I got worms inside of me. She won't say anything more than that. So I go, can I take a look at them? She goes, sure.
Does anybody else see them? Kate, are you coming?
See, I have worms in me.
And there's like a hole in her forearm.
What is this? What have you done?
How do I know when I'm just having a stomach ache or I'm having appendicitis?
The most important thing to consider is where is the pain. Your appendix is on the right lower side of your abdomen. So if your pain is starting diffusely and over a couple of days is moving to the right lower side, you definitely need to go see a physician. As a physician, I know most of the diagnosis, or I'd say 90%, is from the history. It's from what someone tells you. So it's interesting how that's where we're failing. We're not listening. I personally am a huge proponent of vaccines because I know that they've saved millions of lives, but one thing I really, really agree with you guys is that just because a key fits for 1 million locks doesn't mean we have to negate those 4 or 5 locks that it actually hurts or breaks. And so we have to clean up the vaccines. So we have to figure out, we can't just, a few lives aren't expendable. Just because we could save millions doesn't mean a few can be tossed to the side. We just need to not let it go off to the land of bureaucracy and in the land of money, because
That's right.
sometimes that's where it gets lost.
Well, you know, you're talking about acceptable losses, you know, which
Exactly.
they say in the vaccine world, and I really do believe autism has become, you know, acceptable losses, and this is where we have to go and say the time is now. We can't let this happen anymore.
You know what's so amazing is it's such basic stuff. I mean,
Isn't
we're
it?
just talking about such clear and simple things, and unfortunately, when things get blown out of proportion or they're on a different scale, people lose sight of the basics. And so if your pediatrician, unfortunately, is not listening to you, I don't care if it's about autism or if it's about, you know, he has an ear infection, and whatever it is. That means you should be your own family's cheerleader. You should take the next step and see another pediatrician. See somebody else, because if you don't make that move, no one's going to do it for you.
That's right.
Absolutely.
Well put. I'm fine.
I'll be the judge. She's a professional athlete.
Where's the thing I have to sign?
You okay, Steph?
No.
That immediately alerted me. I mean, it's just not a fracture. There's something else going on. As soon as I get the MRI results, boom, it's obvious.
Do you have any idea how much pressure is on her every day? She just collapsed.
Both said right-sided paresis.
Whatever pressure I was feeling before, you could just multiply it by 1,000.
Am I paralyzed?